Contagious bacterial disease that many do not realize is back on the rise across America. If you don't catch it in time, it can be deadly. We're talking about pertussis or whooping cough, and joining me right now to talk more about it is Dr. Stephen Stripling from East Cooper Medical Center. And doctor, thanks for being here. First of all, tell people exactly what whooping cough is.
Well, whooping cough is the common name for pertussis. As you mentioned, it's a highly contagious bacterial respiratory disease. Most of the complications, and you included one of them, was actually death, occur to those that are less than 5 years of age. The challenge for pediatricians is it often starts as a common cold, maybe a dry cough, runny nose, slightly watery eyes, and a paucity of fever. But by day 7 to 10 into the illness, all of a sudden a dramatic cough comes on, fits of cough, and that is often followed by the classic whoop that the illness is named for.
Talk about is there a misconception that this is only for children? Adults should be on the lookout for it as well?
I think the severe cases are generally in infants, but adults, unfortunately, are susceptible. Now, after the primary series of vaccines have occurred in young childhood, the young adult and teenager are now susceptible, and they unfortunately are the vectors of the illness and often pass it on to the young infants where the problems occur.
What about vaccinations?
Well, good question. I will say that the primary series is most important. The CDC recommends five shots, first series through age 4. At age 11, we get a booster nowadays. That was enacted back in 2006 or so. And now young adults, the illness is on the rise. And so the local hospitals are doing a really good job. When moms deliver, right before leaving the hospital, they're vetting out who might be potentially susceptible and getting a vaccine before they leave the hospital. It's safe with breastfeeding, so don't worry about that. The problem is that leaves out the dads and the grandparents and maybe other caretakers who might potentially be bringing pertussis into the household. So we recommend anyone that's going to have considerable time with a child less than 12 months of life to make sure they've updated their vaccine.
Any reason why it's on the rise right now?
Yeah, it's a great question. Very brief history. Back in the early 1900s, 160,000 cases annually occurred with 5,000 deaths. With the introduction of the vaccine in the 40s, the cases went down to about 1,000 by 1970, back up to 27,000 in the year 2010. In fact, just heard today of an adult here in Mount Pleasant who has pertussis. So it's here to stay for a while until we probably get more vaccines enacted. That sort of thing.
All right.
Thank you.
Doctor, thanks for being here. Dr. Stephen Stripling, also with East Cooper Medical Center. We appreciate the conversation.
Dean, thank you.
You bet. We're back after this.
The preceding segment was brought to you by East Cooper Medical Center.